Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for upcoming NORCET exam as well as any other nursing competitive exams. So today also we are going to see important topic. So before that we will start a positive quote. The secret of your success is determined by your hard work and strong focus on your goal. Best of luck. Okay, so you have to think, you have to be in focus, then only you can succeed. Along with the focus you need to put your hard work. Okay, so as last session we have seen an update in the stroke. To this time we are going to see the sepsis. Okay, sepsis update was happened in 2026. So how, when the patient is coming to the hospital with a sepsis, how we are going to manage the patient. Okay, so sepsis 2026 emergency management guide. Okay, we'll see. So what was earlier one 2021 NRC guidelines. So the at present 2026 what update they have brought. Okay, so in 2021 guidelines we have followed Q so far. Okay, what is that Q so far? Quick sequential organ failure assessment. So not reliable alone. They, along with that, they have done some other assessment. But 2026, avoid for screening. When the patient is coming to the hospital, don't use Q SOFA. Nowadays, now we are stopped to see the Q SOFA for the screening purpose. Okay. Next, 2021 guidelines, we have used albumin. First, we will give the fluids and then we have given the albumin. But in 2026, albumin is not recommended. Okay. And then beta lactam antibiotic. So, how we are given this beta lactam antibiotic in 2021? Prolonged infusion. We will give this beta lactam antibiotic continuously, it will flow. So now it's strongly, that is also recommended strongly. Okay. And then oxygen. There is no clear target for oxygen therapy in 2021 guidelines. In 2026 update, we have to maintain the saturation of 90 to 96 percentage. So target for the oxygen. Okay. And then how we manage the shocks? Sequential approach. Sequential means step by step approach we have maintained. But in 2026 update, there is no sequential approach. Concurrent, side by side, you have to do multiple tasks. Oxygen, antibiotic, fluids, vasopressors. So simultaneously we have to do everything, not step by step. So from sequential approach 2026, we have improved to concurrent approach. This is what the updates. We'll see one by one what are the updates have been happened. Okay. So you all know that sepsis is a medical emergency. So we should not wait until the multi-organs failure is to happen. So clinically, the doctors will suspect if the patient is about to get a sepsis. We'll do the lactate levels and all. Okay. So as early as possible, we need to do the screening and timely we need to diagnose the sepsis. So here QSOFA is no longer recommended as a standalone screening tool. You can do along with that. Okay, along with that, we need to do this SARS, news and MUSE. So what is news? National Early Warning, National Early Warning Screening. Okay, and modified early warning screening. So that we can do, and we can choose this inflammatory response syndrome. Okay, that also we can do. So all these things along with the QSOFA we can monitor, but QSOFA alone will not helpful to treat the sepsis. Okay. Second one, the antibiotic, very, very, very important. We should start the antibiotic as soon as possible. So if the patient is having shock, we have to give antibiotic within 1 hour. That is very, very important. If there is no shock, we can wait up until 3 hours. But before starting any antibiotic, we should withdraw the blood test. Okay, so that cultures we have to send. Then we have to start the broad spectrum antibiotic because this blood culture report will take 24 hours, right? So till that we cannot wait. So that time we have to start broad spectrum antibiotic. If the shock is present, within 1 hour. No shock, 3 hours. So remember 1 versus 3 rule. Clear? So this is second rule. Second is fluid resuscitation. Very important. Start with equal or more than 30 ml per kg. Okay. So IV crystalloids we have to start within the first 3 hours of shock is suspected. Okay, so here we are not giving any albumin. What we are giving, RL or plasmolyte. So balanced crystallite we have to give. So we should not give normal saline in the fluid resuscitation. Why? There is a risk of acidosis and AKA. So to prevent that, we have to give RL and plasmolyte. Clear? So first we have seen Q so far is not reliable now, and second one is antibiotic, third one is fluid resuscitation. So what is next one? Vasopressor choice. So as I said, do not wait until the organs are getting failure. So as soon as possible, we need to start the vasopressor so that organs will get their perfusion. Clear? So first line of agents, what we are recommended, norepinephrine. So norepinephrine we have to start, and also one more thing, we should not wait for the central line to start the vasopressor. If the peripheral lines are functioning good, we can give the vasopressor in the peripheral line also. Clear? So this is another rule, vasopressor choice. So next one is hemodynamic targets. So until we should have the targets, then only the perfusion will be good, right? So two things we have to remember when we are targeting something. We should not over resuscitate the patient or under resuscitate the patient. So both can worsen the patients. If you have over resuscitation, pulmonary edema can happen, cardiac overload can happen. If you are under resuscitation, the organs will not get a perfusion. So both things we have to remind when we are treating the shock. Okay. So what is the target map? Mean arterial pressure. So if it is 65 mm of Hg is a hemodynamic target. Clear? So don't think that more than that 65 will improve as soon as earlier the patient will come out of the shock. No, that is not a thing. So we have to maintain the 65 mm of Hg. Gradually we can increase. Okay. If you over treated higher targets, if you are seeing, that can lead to arrhythmias. Clear? So remember that the map is 65 mm of Hg. So next, uh, one more thing is they have updated that. So CVP alone or CVP is not longer reliable for the sepsis or fluid resuscitation assessment. Okay. So what we have to think, we have to check for the passive leg raise. If you elevate the patient leg, so the arterial BP will automatically will show the increase in the levels. Okay. So that we can do. Stroke volume variation and bedside ultrasound of IVC or venous excess ultrasound. So what they will do in this ultrasound, they will see the diameter of the inferior vena cava. Okay, so that will give you the clear idea of your whether it is collapsed or not. So that we can see. Clear? So these things are the very important to assess the fluid status when the patient's on sepsis. Okay. So along with that, fluid resuscitation, antibiotic, vasopressor, adjunctive therapy is also important, but steroids are usually not required for all the patient, but in some selected cases like septic shocks with the persistent instability. Okay, we are giving proper fluid, we are giving a proper antibiotic, we are giving proper vasopressors, but still patients are persistently instability. That condition we can give the steroids. Okay, that is about adjunctive therapies. So we have done all the preliminary treatment for the patient, but still we should not miss one thing, that is the source control. Where is the infection? The exact where the infection started, that thing we have to check. Whether it may be any wound or it may be any contaminated devices attached to the patient, that we have to find out. So that is source control. Clear? Yes. So this is the sepsis checklist. If you are not able to remember anything, at least remember these things. Lactate, measure and repeat if the level is more than 2 millimole per liter. So that lactate is very crucial in sepsis checklist. And culture. So before starting any antibiotics, we have to withdraw the cultures. So start the broad spectrum antibiotic as early as possible. Fluid resuscitation 30 ml per kg, balanced crystalloids. Okay. And vasopressors, norepinephrine, our target of MAP is less than, sorry, not less than 65. Okay. Equal to 65 we can maintain. Okay. So these are the updates what happened in the 2026. Okay. I hope you understand the class. Okay. I will start a new session with another update in the next session. Okay. Thank you all. All the best.